Hello everyone, welcome back to my channel. Today we're diving into managing menopause in Chinese women. By 2030, there will be an astounding 280 million menopausal women in China, accounting for 23% of the world's menopausal population. That's a lot of women navigating a significant life transition. With the average lifespan for Chinese women rising from 71.5 years to over 80 since the 1970s, many women experience menopause between the ages of 48 and 52. This means they could be in menopause for a third of their lives. That's a big deal. A survey from 2013 of over 1,600 women aged 40 to 60 found that the top menopausal symptoms include fatigue, mood swings, insomnia, joint pain, and hot flashes. And guess what? Other symptoms like depression and dizziness were also reported by more than half the participants. So how do we manage these symptoms? The 2023 Chinese guidelines for menopause symptom management recommend various strategies, including Chinese medicine, soy isoflavones, and hormone therapy. Interestingly, non-drug therapies like acupuncture, cognitive behavioral therapy, and mindfulness were also highlighted. Chinese medicine has been a part of the culture for thousands of years, while Western hormone therapies only made their entrance in the 1990s. Many Chinese women feel a strong connection to traditional Chinese practices, often opting for Chinese medicine for overall well-being, even when seeking symptom relief from Western treatments. Let's take a look at a study comparing hormone therapy, specifically conjugated equine estrogen, with a Chinese herbal medicine called Untitled Chapter. This study involved 300 women divided into two groups, one receiving hormone therapy and another taking Untitled. The results showed that while the hormone therapy group experienced a quicker reduction in hot flashes at the 3-month mark, both groups demonstrated similar improvements in symptoms like insomnia and mood after 6 months. Quality of life also improved at a comparable rate across both groups. Side effects are an important factor too. The hormone therapy group reported higher incidences of breast tenderness and vaginal bleeding, while the Kuntai group had significantly fewer side effects. However, it's worth noting that the evidence for Kuntai's efficacy is still emerging, and more robust research is needed. In summary, both Chinese medicine and hormone therapy offer potential pathways for managing menopause symptoms. While Kuntai shows promise, further studies are essential to ensure long-term safety and effectiveness. So whether you lean towards traditional practices or modern medicine, always consult your health provider. Remember, the best approach is one that has proven safety and suits your individual needs. If you found this video helpful, please give a thumbs up and subscribe for more insights into health and wellness. This will really help me build my community for balanced and evidence-based menopause and health content. Please also share this with someone who may benefit to help clarify menopause misinformation. And finally, please share your experiences about menopause in the comments below and normalize this conversation.